So on this week, we have another 10 questions, true, false questions, 2 upper limb, 2 lower limb, 3 head and neck, and 3 abdomen, thorax and pelvis. So again, we're trying out this new software. So what could possibly go wrong? Let's find out, shall we? So the first question is, the Flexocarpi ulnaris attaches here. The Flexocarpi ulnaris attaches here. So now this is the distal aspect of the humerus, and of course this is the lateral epicondyle. So does the Flexocarpi ulnaris attach here? The answer is no, it doesn't, because the Flexocarpi ulnaris actually arises from the other side, from the medial epicondyle of the humerus, from the common flexor origin. Now it's a long, slender tendon that attaches downwards into the hand, onto the ulnar side of the hand, and it has a sort of fan-like arrangement of its attachment. It attaches to the pisiform bone, the hamate bone, and the base of the 5th metacarpal. Next question. The median nerve lies deep to the brachioradialis in the forearm. Does the median nerve lie deep to the brachioradialis in the forearm? Is that true or false? If anybody's out there, please give me a thumbs up so that I know that this is live. I'd love to know what you think. Put in your comments, is this true or false? The answer to this question is actually false. Now, the median nerve doesn't lie deep to the brachioradialis in the forearm. It lies deep to the flexor digitorum superficialis muscle. And you can see it here. Let me just point this out for you. You can see it here coming down the forearm, and it enters the forearm. And where it enters the forearm, actually, let's take a look at that more closely. Because it enters between the 2 heads of this muscle here. Now, this is pronator teres. And as it dives under there, it then comes deep to between the 2 heads of flexor digitorum superficialis and goes on downwards to the hand. Now, what about the brachioradialis? What happens there? Well, it's actually the other nerve. This is now the median nerve, and the median nerve attaches, and this is a radial nerve that comes down, and it dives under brachioradialis here to go on downwards towards the hand and wrist. So the radial nerve goes under brachioradialis, and the median nerve goes under flexor digitorum superficialis. Next question. The sciatic nerve emerges distal to the piriformis muscle in the gluteal region. Does the sciatic nerve emerge distal to the piriformis muscle in the gluteal region? True or false? The answer to that question is actually true. It does, and here it is. You can see the piriformis muscle here, and it's actually a landmark muscle, particularly when you're doing surgery in that region. If you get to the piriformis, you know that the sciatic nerve is just underneath it, as are many other structures that emerge from underneath the piriformis muscle and go on to supply structures in the gluteal region. And the sciatic nerve, of course, dives down the back of the leg, supplying structures further down in the leg. Now, if you're wondering about how to remember all these structures, there's a great video that I did on YouTube with a fantastic mnemonic called Your Bottom's a Busy Place. So go and take a look at that to see how you can best remember the structures of the gluteal region. So the next question. The spring ligament of the foot passes from the talus to the navicular bone. Does the spring ligament of the foot pass from the talus to the navicular bone? Is that true or false? The answer to that question is actually false. And as you can see here, the spring ligament, I'm going to point that out to you, is tucked up under here, and it actually runs from the calcaneum through to the navicular bone. So in order to see that a bit better, let's just tilt that bone so you can see it more clearly. Here we go. And here it is. There it is, the spring ligament, and it's also known as the plantar calcaneo-navicular ligament, and it goes from this ridge of bone here, or this rather large protuberance of bone, the sustanticulum tali, from the calcaneum down towards the navicular bone. Now, the function of this ligament is to support the head of the talus, and it also resists that medial arch from collapsing. So that's the spring ligament. Next question. The pituitary gland lies within a depression of bone found in the ethmoid or ethmoid bone. Does the pituitary gland lie within a depression of bone within the ethmoid bone? Is that true or false? The answer to that question is false. It doesn't actually, because here it is. It's lying within this bone here, which is the sphenoid bone, which is sort of got that like bat wing kind of sort of formation there, and it further enforces that with these little slits here, which look exactly like two little eyes. So that's the sphenoid bone, and here is the pituitary gland tucked in just there. So let's just show you, I wanted to show you actually what the ethmoid bone does look like in relation to this. Let me show you this. So if we add the ethmoid, there it is. It's in bright blue, and it's in front of the sphenoid bone, and nothing to do at all whatsoever with the pituitary gland. So there is the ethmoid bone, and here is the sphenoid bone, pituitary gland, and this is this sort of anterior view. Sorry, look, this is the posterior view looking from behind, and this is with the bone turned around to the side, so the ethmoid bone is protruding anteriorly there. So, next question. The greater petrosal nerve innervates the lacrimal gland. Does the greater petrosal nerve innervate the lacrimal gland? Is that true or false? Now, this gets a bit tricky, I have to admit. Let's take a look at this. So the answer to that question is actually true. It does. And here is the facial nerve, and it gives off the greater petrosal nerve, which dives, it forms part of the nerve of the pterygoid canal. It dives into the sphenoid bone there, and it goes into the pterygoid canal. So let me show you a diagram which may try and break this down for you a little bit easier. So here we have the nerve of the pterygoid canal, and the greater petrosal nerve, which is a branch of the facial nerve, and the deep petrosal nerve, which is part of the carotid plexus. And it comes and forms, and these carries parasympathetic fibers to the pterygopalatine ganglion, which synapse here, and then they send off fibers through via the maxillary nerve, which then splits off into the zygomatic nerve, and it's through the zygomatic nerve that it reaches the lacrimal gland. So that's how the greater petrosal nerve does contribute to the lacrimal gland, and it actually causes it to produce secretions. Okay. Next question. The floor of the oral cavity is formed by the mylohyoid muscles. Is the floor of the oral cavity formed by mylohyoid muscles? Well, the answer to that question is actually true. Yes, it is. I'm going to hide me so you can get me out of the way. And here you can see three views now of the skull. This is the sort of obviously the anterior view, which is slightly tilted, and there you can see tucked underneath is a mylohyoid. Now, if you spin the skull round so that you're looking up inferiorly, now you get a much clearer view of those two mylohyoid muscles that meet in the middle, and they go on to attach on the hyoid bone, which is shown more clearly down here. So let me just move that out of the way. There you go. Now you can see the hyoid bone. So it forms like a hammock, if you like. So next question. Is anybody with me? Can you give me some comments or reactions? Give me some thumbs up or some clapping, or I don't know, just so that I can see if you're here. Let me know where you're from, because that is lovely. Oh, hang on, okay. I just found where all the comments are. So somebody says, Oh, Abbas, yes, you told me about Clubhouse and how we should get onto Clubhouse. Mohammed, thank you for saying the answers. Okay, next question. The abdominal aorta lies to the right side of the inferior vena cava in the abdomen. Is that true or false? Does the abdominal aorta lie to the right side of the inferior vena cava in the abdomen? True or false? By the way, I've just got the message that Alex was saying that there was no sound. Could you please let me know if you can hear me? Just send me a thumbs up if you can actually hear what I'm saying, because that would be super helpful. All right, the answer to this question is false. It does not. The abdominal aorta actually lies to the left-hand side of the inferior vena cava, and you can see here it is, the abdominal aorta coming down, and the inferior vena cava is this blue one here on the right-hand side of the aorta. So the aorta is left of the inferior vena cava. Okay. Next question. The superior epigastric artery supplies the anterior abdominal wall. Is that true or false? Does the superior epigastric artery supply the anterior abdominal wall? Well, the answer to this question is true. It absolutely does. So let's take a look at how it actually gets there, because it's quite a long journey that it takes. So here is the heart, and from the heart you can see the aorta, and from the aorta you eventually get to the subclavian arteries, the brachiocephalic artery here, which then gives off the subclavian artery, and the subclavian artery on the left is direct, of course, from the aorta. And here you can see two long, slender arteries here, one on either side. So let's turn that round so that you can see that a bit more clearly. There we go. So I've removed the ribs on the left-hand image. Now you can see the heart and the arch of the aorta. I've removed the common carotid artery so you can see these things a bit more clearly. So here's the brachiocephalic and the subclavian, and there's the internal thoracic artery snaking down forwards and turning into the superior epigastric artery here. And likewise, on the left-hand side, you can see the internal thoracic artery coming down here, down, down, down to become the superior epigastric artery. Next question. The right kidney lies posterior to the tail of the pancreas. Is that true? Does the right kidney lie posterior to the tail of the pancreas? True or false? Well, the answer to that question, I'm getting some, thank you, Dai, thank you, Jaitan Pal, getting some answers through. The answer is thank you, Mohammed. You're giving me answers. Is actually, oh, let me get my big head out of the way. There we go. The answer to that question is false. It does not. Now, let me show you why. Because the right kidney is this one here, but it's the left kidney. And look, here's the tail of the pancreas. Here's the head and the body curling round there to form the tail of the pancreas, which sits directly in front of the left kidney. So that is our quiz today. I hope you've enjoyed it. We're getting to know the software a little bit better. Tell me if you like this format. Tell me if it's useful. Please do go onto our website. You have to just see some of the most amazing videos that our creative director Jill has been producing this week on the head and neck. We're releasing one every week. I've been beavering away on the Let's Refresh for the abdomen. So those videos should be coming to you in the next 2 weeks. This is all on our website. We also have regular daily content on the Instagram channel, which is at Funky Anatomy. So this is a mixture of study motivation tips and also anatomy tips. So there's usually a daily quiz that you can take part in. Thank you so much for joining us. It really does mean a lot to me that you come and you take part and you show up. Alex, I'm so glad you finally got the sound. Thank you to everybody who's joined in. And until next week, it's Friday, so stay funky.